Shelby, some of the patients who are most impressed with our office are the ones we actually refer out of here. I had a young girl as a patient about 5 years old. She had seen her pediatrician the year before, and they had a computer that gave an approximate prescription of what she was wearing. Here's the kicker. In one eye, it showed that she didn't have any prescription. In the other eye, according to the parent, they said there was no problem with it. The prescription was about a +3. And I'm just going to reach into my kit here for a second. And if you can see how strong a +3 looks on my eye compared to the other one, it's pretty big prescription. The problem was when we examined the child, in one eye she was able to see without the prescription about 20/25. For a 5-year-old, that's great. With the other eye, even with the best prescription possible, which was approximately this, the best she was able to see was 2200. And that is the definition of a lazy eye. I believe it was lazy for the fact that her brain received no information from that eye because the eye was so out of focus. So how do you deal with this? You work with it basically by 1, patching the eye, 2, getting the eyes and training them to work together, and 3, eventually, in my opinion, if you can, being able to put a contact lens on that eye, not on the good eye, but on the eye that's really has a high prescription, because look at the difference in magnification as I bring it closer. There's no difference in image size between the two eyes. And when you put it on the eye in the form of a contact lens, the eye has a better chance of working together. Thing of it is, I don't do training. I used to, I know a lot about it, but I was going to send the patient to one location close by, and because it was close by, and the father asked me, if it were your child, would you send her there, or would you feel there was somebody better? I said, how far do you want to drive? And he said, it doesn't matter. Send her down to Newport Beach, where I feel she'll be receiving some of the best care by a doctor who's world-renowned in treating this type of patient. Bottom lining it, if this patient had gone much longer without intervention, the best correction might have been 2200, and no matter what was done, her vision might not have been able to improve. We're hoping that this child will be able to see, when appropriately corrected with glasses or with contacts, she'll be able to see 20/20 out of that eye that is right now best corrected to 2200.